This segment of Delmarva Life is sponsored by TidalHealth.
Sleep apnea. It affects millions of people, and for many, finding the right treatment can be a real struggle. Now, while the CPAP machine has long been the standard solution, not everyone can tolerate it.
Now, that's where a new approach called Inspire comes in. This innovative therapy works from inside the body to help patients breathe more naturally while they sleep. Joining us to explain how it all works are Dr. Julie Berry and Dr. Kunal Agarwal, who are at TidalHealth. Dr. Agarwal, welcome. And tell us, we've seen the commercials. How does this magic work, this Inspire?
Yeah, thanks for having me. So Inspire looks like this. It's a pacemaker type of device, right? It works from inside the body, and it helps patients who have moderate to severe obstructive sleep apnea. And then to turn it on, you use this remote before going to bed, and you push on. And it helps your patients breathe better and sleep throughout the night.
So you say this is for people with severe sleep apnea?
Moderate to severe obstructive sleep apnea, and you have to be an adult.
Oh, okay. Okay, so how does it differ from the traditional treatments?
So CPAP stands for continuous positive airway pressure, right? So you have to wear some type of mask on your face, connected to the hose, and that provides air to keep your airway open. But as we know, some patients just can't tolerate it, right? They feel claustrophobic, it's not sexy, right? It leaks. And so Inspire is a really alternative option, and it helps stimulate the nerve in your tongue, the hypoglossal nerve, to push your tongue forward. So that's how it relieves the obstruction. It helps you sleep a lot better at night.
Wow.
So it's hard to wrap your head around that, but it's actually something that's internal. So Dr. Berry, can you explain it a little bit more in layman's terms for people who are trying to understand how it works?
Yes, absolutely. It's a surgical procedure where there is a small incision made a few finger breadths below your collarbone, and there's another incision right underneath the jawline here. In this pocket, we place the device that Dr. Agarwal had shown you. It's both a sensor and a stimulator, or a generator. So it senses your chest movement when you're breathing at night, and it generates a stimulus that goes up a little wire that channels under the skin up to the nerve that he mentioned, the hypoglossal nerve. It wraps around that nerve, and when you breathe in at night, it stimulates that nerve to stimulate the tongue to move forward. We want the tongue forward and away from the back wall of the throat so that there's a more open airway above. And it coordinates with your breathing. It senses the breathing patterns, and it puts a little stimulus each time you breathe in, just like clockwork, very precisely, and stimulates just the branches of that nerve up here that push the tongue forward, not the ones that pull the tongue back, but push the tongue forward.
Wow. Do they feel it as they're sleeping?
As they're falling asleep, they may have a slight tingling sensation. It's not described as uncomfortable at all. In fact, some patients like the feeling because they know that the device got turned on. It's one of the only ways they know it got turned on. And it also is something where they're usually, at that point, so accustomed to having that burden of that CPAP mask bugging their airway and throwing that really extensive amount of pressure back in there, that the little initial tingling that they might feel, and even then just intermittent, is typically not bothersome to them at all. And most patients don't even feel that.
Huh.
Yeah.
So with any medical procedure, there's benefits and risks. How does this play out for folks?
Right. Well, as we mentioned, it's a surgical procedure, so there certainly are the risks of anesthesia. When I mentioned that it was a surgical procedure, there's actually two components to the surgical portion of it on different days. They go for what's called a drug-induced sleep endoscopy, where we first check their airway with an endoscope that goes through the nose when they're sedated, mimicking that level of sleep where sleep apnea happens. And if they have certain parameters that we're seeing as far as the collapse of their throat muscles, and they're considered a candidate to go on and get the actual implant procedure, then we bring them back to the operating room another day. That second procedure is under general anesthesia, so the risks of general anesthesia. Potentially a little bit of bleeding, things that are very unlikely would be wound infections, exceedingly unlikely. The stimulator is wrapped around the nerve, and there can be a little bit of swelling around the nerve where they get a little bit of tingling of the tongue and the throat and some discomfort with talking and swallowing for a few weeks after the procedure. But all told, an extremely safe procedure.
Interesting. So if somebody's watching today and they're really frustrated with the whole CPAP, what's your message to them?
So if you're really struggling with CPAP, I would say don't give up. There's other options out there. Inspire is a really safe, effective, and alternative approach. And at TidalHealth, we walk the patient through every step of their process. So We have ENT involved, we have sleep involved, all our office staff to guide them through the screening process, the DICE procedure, the actual implant authorization from insurance, actual activation, finding the right settings that work for the patient. But I think patients who qualify, you're an adult, you're really not tolerating CPAP therapy, and you are not significantly overweight, and this is a really good alternative option for you, and I would reach out to us.
All right, wonderful. Dr. Agarwal and Dr. Berry, thank you so much for coming in and talking about this wonderful thing, Inspire.
Fascinating. It really
Yeah,
is.
yeah.